Hi there. Welcome to the current episode. This is episode 21 of the Aspergers and Marriage Podcast, and we have a very special guest today. Gloria Rivera King is here with us, and we'll just jump right in. Welcome.
Thank you so much for having me. It's truly a pleasure to meet you both and be here.
Awesome. And you're also one of our featured guests. So we have two segments we could put this in. So glad that you're on board, and we'll touch base on that. But just a little bit about your background and how you got to be kind of interested in what you're doing.
I have been in practice since 2008. I worked with couples since my internship. So I don't know that I necessarily thought I wanted to work with couples, but that's how it was an internship and realized that I enjoyed it and liked it and have done it since then. I work with adults only 21 years of age and older, but couples has always kind of been something that I've lean towards and just enjoy all the different dynamics and personalities that you have. And I think that it's been interesting to see all kinds of couples, young couples, not married couples, same-sex couples, polyamorous couples, you name it. It's quite interesting, never a dull moment for sure.
Absolutely. Now, you've been a member of our Aspergers and Marriage Women's Group, and if you could just jump into kind of what are your thoughts on the group, and are you finding it supportive and
Oh my
encouraging?
goodness, so supportive. And I really like that you both are able to monitor and kind of chime in and kind of notice some of the things that are going on. Like recently you talked about instead of how do you qualify something? Some people like the term Asperger, some people don't, some people like the term autistic, some people don't. The emotional blindness. I thought, oh, I love that, right? Because I think that's something that a lot of people can relate to and be more open and lean in toward instead of being like, oh, I don't want to be called that, right? Because we can all be emotionally blind to some level or another.
Yes, I think sometimes the word matters,
Mhm.
especially with Patrick. As he shared, he prefers different words. So now I just picked up a new word, idiosyncrasies. Like
Oh, I
now
love that.
another client was using that word in their neurodivergent relationship, and I said, I'm going to take that word and begin to use it.
Absolutely. Yeah. I think it's important to just speak a language that feels comfortable for whoever your audience is.
Yeah, and sometimes I know for me, it was almost easier to say on the spectrum or
hmm
neurodivergent, the word
hmm
neurodivergent. Um, Patrick prefers others. So it was difficult at first for me to change. And also, I'm a clinician, so those are really words that I use.
Right.
Um, but but so yeah, it's good. I like it that someone can ask for what they need and even challenge me with how I speak to certain.
Yeah, absolutely. And Patrick, I love that you're a part of it from both the perspective of the Asperger's and from a male perspective, right? Because traditionally, in any kind of counseling, women are usually ones to lean in, and men are be like, I'm going to be like, do we really have to go? Do we really need that? I don't know about this. I'm not sure, right? And so I love that you're open to have um, the opportunity to share with us your experience from your perspective and also normalize for other people listening or that are part of the group, especially men, to be like, hey, he's talking about something I can relate to. I think that's so important.
Yeah, and I think that's what makes us unique. But yeah, I really we are pretty real. I mean, I share difficult spots as well as highlights of
hmm
just how. So I just have to say, so we meet with couples, obviously. But what I'm learning about myself in us doing coaching with others that are like us, neurodivergent, and well, see, I'm already using the word, but like us, there are things I'm telling you, Dr. Gloria, where I'm like, as he's saying it to the couple, I'm like, wow, this feels so rude. So
Mm-hmm.
for a neurotypical, it feels like whatever. And then to see that the neurodivergent guy is like, yeah, that's right. And even the
hmm
woman getting the perspective from another neurodivergent.
Right.
But just kind of like, so it's kind of been growing me in many ways, just kind of seeing
Mhm.
that we speak different languages, but what he has, other people um, can, they're hearing the way they're understanding his language.
Mhm.
So it's
Mhm.
been kind of nice because, deep down,
Yeah.
I'm like, oh my gosh, this is so rude. And no, it isn't. They're laughing.
Right. Right. Exactly. Yeah. Yeah.
Okay, so I want to dig into and Dr. Gloria, what with your experience? So we have a lot of women in our group where the husbands have not come around yet. The women are in severe emotional
Mhm.
pain,
Mhm.
and we're trying to kind of dance around. Okay, do we, Asperger's, and try to emphasize the positive traits. You're a very good
Mhm.
provider. You're
Mhm.
very loyal. You don't cheat on your wife. So we're trying to get men to
Mhm.
accept the positive aspects, kind of throwing in maybe emotional blindness. But what is your experience? How do you coach women on the women knows that you've talked to him, the husband has this condition, and to bring him to where he's receptive to counseling or coaching? Do you have any success stories with kind of helping women out, encouraging their husband to accept these traits?
Yeah, I have one, interestingly enough, where she and I were meeting, and I shared my impression that although I cannot, of course, diagnose anybody who's not in the room, I was saying to her, it sounds like I can hear from your description of your husband's behavior, certain things. There's some characteristics of autism. Well, she mentioned that to her husband, and her husband was like, huh, I never thought about that before. So he started researching it and Googling it, and he's like, oh my gosh, I can't believe somebody I haven't even met has identified some of the things that I, in my own therapy, haven't even had anybody suggest to me. So he came in out of his own volition, and he wanted to learn how to better meet her needs, and really struggles with the difficulty of things not coming naturally to him. Kind of when you were speaking earlier about sometimes he says things and I'm like, oh my God, he's being so rude. He was giving examples of sometimes we're all together and somebody says something and I just don't get it. And everyone else seems to get it and I don't get it. And so we've talked about some very basic communication things, such as when your wife comes home at the end of the day, if you're in your room on your computer, how about you leave your computer, go out and greet them, and how important and connecting that can be. So something so small and seemingly insignificant that to him just really, he's like, kind of like, well, she knows I love her. I know she's home. The dog knows she's home. I don't have to
Right.
get up and go and say anything to her. But we talked about that was his perspective. What about her perspective? What might she be thinking if he didn't get up and greet her? And what might she feel if he did get up and greet her? So something as small as that
Right.
has been very connecting for the two of them. And
Hmm.
he was like, "Oh, this whole time I just didn't think that was an important thing to do. Like it's not important to me, so I didn't think that it would be important to her." So it just gives you an example of how we can have such different interpretations of something that happens every day to all of us, and one of us sees it one way and the other person is not affected.
Absolutely. And what I find is that the men that we work with just needed reminders and need to kind of relearn this stuff and work it into their routine. But the wife can't be the one that initiates this, or else it's
Very
a
true.
source of friction and so forth. One of the things that also is a recurring theme in the group is how men initially, Asperger men, in the courting stage, look back whenever your husband was courting you, you're the special interest, there's affection,
Mhm.
there's, oh my gosh, you're on
Mhm.
his mind. And then all of a sudden you get married and he switches to provider mode, where all of a sudden
Mhm.
I'm going to love you with tasks and providing and this and that.
Mhm.
And what I like to, in my case, we had a post where somebody said, "Oh yeah, your husband was just masking back then," and it's
Mhm.
like, no, that was real. That is, if you're
Mhm.
my special interest, you're my passion, and in my mind, I just switched gears. But what are your thoughts on that, as far as A, the definition of masking, and then
Mhm.
B, just no, you were the special
Yeah.
interest, and that just changes over time. Your thoughts on that?
Yeah, you bring an interesting perspective when you say, I wasn't masking. I generally felt those things. And I was very interested in, if you will, like intoxicated by them. That's why I wanted to spend all my time with them. I think Where it can get into masking is our feeling as women that, well, if this is what I saw before marriage, there's some expectancy to have some continuation of that after marriage. So when we don't see that, we almost feel like we got fooled or duped. Like, did I marry like a representative of you? And is this really who you are or not? And I think you said something really important where you said, I switched from special interest to provider mode, right? And so maybe for you in your mind, it's like, well, of course, that's just a natural order of things. But for most of us partners, we're going, wait a second, like how did this happen and why did this happen? And I think we don't always know what to do with that. And so we can feel, like I said, fooled, duped, disappointed, angry. And if we try to attempt to talk about it with our partner, they may look at it like, what are you talking about? Like, I've always been a good provider. I continue to be a good provider. You are still someone that I love. I just kind of went back to doing the other things that I was also interested in. So there has to be a balance, right? And that's a word that I use a lot with my couples is where can we find that balance where we feel like both of your needs are being met?
Matheta, your thoughts on that? And what have you seen in me, as someone who's kind of seen me come back around? Your thoughts? You're muted. You must have muted. Yep.
Yes, I was trying to avoid the hammering that's going on right above, feels like my computer here. So sorry. Kind of going on what we were talking about earlier. The word, the label. So things that you were, that matters to you particularly. So the same thing is still happening. But the word that we use, the way that we identify it is what's changed. And that creates then, I don't know, acceptance almost, understanding almost, or compassion. Or so I think just that is a big deal, I think, in our marriage. I think in our situation, whatever we want to call it, because we were married, I don't know, 20 years or whatever before this diagnosis, it just was my husband. Right. So it didn't have a label or any words.
Right.
But suddenly then the diagnosis, and then came the words, and for me, compassion and understanding. That also simultaneously happened with some things for me. I started working more. I was a stay-at-home mom for a minute, and but some other stressors added to that, postmenopause, different things, to where it became I was jacked up on adrenaline and cortisol, trying to do with simultaneous things. But anyhow, well, that's all I have to say about that.
Sounds good. And then Dr. Gloria, what a lot of women experience, and yourself being a professional, where you have your professional career, you get married, your needs, emotional needs are being met perhaps by your career, by your kids. And then all of a sudden, as the couple gets older, the kids move out, perhaps the husband, COVID, or they, retire. It seems to get worse. We've talked to a lot of wives that, oh my gosh, it's going to be so much better when my husband comes home and he retires. And then all of a sudden it's worse because she's still getting ignored and he's there all day.
Right.
Your thoughts on your personal experience, and you're in our group, and just share your thoughts on how you're kind of dealing with this, being, having a husband with these, traits, and your thoughts on that.
Yeah, so that was a very big challenge for me for a long time. And Teresa, we were sharing earlier before the recording, I'm from Puerto Rico, you've got family from Mexico, right? And so I grew up in a very demonstrative, loving, affectionate, warm family. And traditionally, Latinos, Hispanics, we kind of have those characteristics. We're very sort of touchy-feely, warm and fuzzy. And that's
right, Patrick?
Oh, yeah.
Okay,
yeah.
go ahead.
Yeah. That's one of the things that my husband loved about me and my family. And because I was such a special interest, I got so much of that. And I was like, this is amazing. This is what I'm familiar with. And my husband is going to be like that too. So it was like, it was very confusing to me. So I immediately started thinking, what's wrong with me? Am I not doing something? Am I not being a good wife? Like I just immediately started thinking something was wrong with me. So that was part of, like, I just wanted to go back to that piece about the masking and, the special interest that we had to kind of have an understanding about. And then again, balance. Like I've had to tell my husband, okay, tell me how much time you need by yourself or to do paperwork or whatever you're doing, and then can we spend some time together? Sometimes I've had to tell him I'm feeling ignored. So can we do something together? And he might be like, oh, I'm sorry. Like I had no idea that you felt that way. So I had to be much more direct with him about what I was feeling and experiencing. And he and I have a bit of an age gap. So I have thought a lot about what is it going to look like when he's retired, because I don't want to retire when he retires, whenever that will be. And I've talked to him about what can we do together, either some things we haven't had a lot of time to do, or something that might be a future mutual interest, so that I know he'll have alone time and do his own special interests and projects. But to me, I'm always looking for connection. That's just kind of how I love that. I'm wired that way. So what are some things we can do together? Like we both love dogs, right? So we've thought about, like, in the future, do we want to do something like foster dogs or create our own shelter or something that will give us something that is unique to us and gives us a way to connect? I have also teased and said, even if I wanted to also retire with you, like, you would get on my nerves, and I'm sure I would get on your nerves. So we have to have something where it brings us together and then
Yeah.
respect the time apart.
Absolutely. And for my wife and I, we were up and down. It was during COVID that we kind of discovered my situation, and that's what really magnified it. But before that, I had problems with meltdowns, with anger. We had been on the verge of divorce. And I just remember my wife saying, I can't live like this. I just can't live like this. In my mind, she was saying divorce. And in her mind, it wasn't. It was just, she was just venting. But have you ever had those moments where you were just like, I can't live like this, and just emotionally frustrated? And how did your husband react to that? Your thoughts?
Yes, absolutely. And it came as a shock. He's like, "What are you talking about? Like everything is
Right.
fine."
Haven't you been listening? What do you mean? What am I
Correct.
talking about? Yeah.
Correct. Yeah, because it's not like we're fighting, we don't have these major problems. And I'm like, yeah, except I feel invisible,
Right.
like,
It's a
hello, remember me,
literal.
your wife, right? So I would
Yeah.
often say to him, I would feel like I was not on his radar, right?
Mm.
Like the world was going along and he was going along, but I didn't feel part of it. And so to him, things were fun, which I often see with a lot of my couples, neurodivergent or not. And so I had to be just much more clear about it. I think it's fine for you, but it's not meeting my needs. And so the things that I needed to change is to have him spend more time with me, to be more attentive, to do some of the things he used to do, whether it was early in marriage or before we dated. Because although he still felt the same level of connection, if we weren't doing that, I was not. So to me, it needed to be maintained. Those gestures, those thoughtful, loving behaviors that helps you fall in love with your partner in the beginning. Like I needed some of that sprinkled here and there for us to keep going and for me to feel like I was still important to him. Like I knew he loved me, but I didn't feel like he loved me, if that makes sense.
Oh, sure.
Yeah, of course it makes sense. I want to comment on the literal when I would say I can't do this anymore. I mean, you can see right there, he really took that literally. Like, I'm done with you.
Mm-hmm.
To me, just meant I'm going to my mom's for dinner. Like, I don't know.
Yeah,
That's what it meant. It just meant I
right.
better go take a bath or something. But yeah, for him, it was like, what? Just that literal difference
Yeah.
in our relationship. I want to comment because women, so we are women in our culture, so also Hispanic, but also maybe American
Hmm.
culture, or right, you said you're Puerto Rican, but
Hmm.
different cultures can affect for maybe neurotypical women is the way that we've seen women perhaps really put others ahead of them, their
Hmm.
emotional needs in front of
Hmm.
yours, and just
family.
kind of that
Yeah.
give, sacrifice, and sometimes to a deficit to where, wow, what about me? Now it's been a
Hmm.
couple years, I went without such and such, and wow, I'm depleted, or I would like this. But that's why I think self-care is vital. But I just
Hmm.
want to point that out, just we had talked about, cultural
Yeah, absolutely.
impact.
And I think that's an important point because I think we feel all those things you said, plus we have a desire to want to be a good spouse, a good wife, a good husband. And so for
Yeah,
me, I part of my struggle was feeling like I was doing the things to be a good wife, and I wasn't getting the response that I was hoping for. And instead of thinking, well, let me do less, I just kept doing more, which made me feel even more depleted,
worse.
more angry, resentful, right? And then he's
Yeah,
over here thinking, I don't know what you're talking about. Like everything is
right,
fine. So
right.
it can feel very much um crazy making, right? Like, and again, being a therapist in my profession, I was like, why am I doing these things with success with my couples, but I don't feel like I'm getting success at home? And things wouldn't necessarily resonate with him that I thought that I expected would. So it was a big, long journey to trying to figure out what my own needs and wants and feelings were, what his was, where the gap was. I don't mean to make it sound like, oh yeah, we just figured this out and it was so easy, right? Because it
Hmm.
wasn't.
Yeah.
And not having the language for things, right? We didn't know some
Yeah.
things, back in the day, but having the language made me go, oh wow, that's what that is. And then I can get curious about it and understand it and feel like you're empowered to figure out something you can do with it that can be helpful to both of you.
Yeah, and our formal training as therapists, there is a certain way that is that might not be best practice, I think, for neurodivergent, neurotypical. So Gottman, I love Gottman,
Mm-hmm.
use Gottman with my couples,
Mm-hmm.
etc. There are things about Gottman that are not best practice with my husband.
Mm-hmm.
First of all, that emotional blindness or that I
Right.
statements and using I, or 70% of marital issues are perpetual. Um, I don't know. So there's some things where there's a little bit of tweaking
Yes, absolutely.
that we have to do, I think, in neurodivergent, neurotypical relationships.
Absolutely. And I think you probably have encountered this as well. But my husband would say, don't therapize me, right? Or I'm
Oh,
not one of
yeah.
your clients. Like, don't do that. Like, or you only think this way because you're a therapist. I'm like, no, that's not true. But definitely
This
you
is
have to
who I
tweak
am.
it
Oh my
in
gosh,
a
Yeah.
yeah.
way that honors them and makes them feel like, yes, I see you as my spouse, not as a client.
Right.
Absolutely. Well, we got just
Yeah.
a few more minutes, but one of the things that we try to share is that the neurotypical wife isn't looking for super big change. It's just
Right.
something, a little work me into the routine in the morning, give me a hug, give me a
Yep.
kiss. If you're able to have lunch with me and talk to me, put your phone
Hmm.
down, hug me throughout the day. We in the massages, my wife does marathons and triathlons. I massage her. She's always has aches and pains.
Hmm.
But just what are some of the little things that maybe your husband does or that you would advise that are realistic that someone like me can work into their daily routine that'll make their wife feel special and add affection and intimacy just in the daily.
Yeah, I think for me, it's remembering important occasions, whether it's our anniversary, birthdays, things of that nature, acknowledging that, asking me how I'm doing and what's going on with me and my world, asking about things that are important to me. So whether that might be friends, family, a trip that I have coming up with my niece, right? Like showing interest in the things that I've expressed are important to me. Just even noticing, like pausing and giving me undivided attention. Like you said, maybe not being on your phone or turning away from the computer. I like eye contact. Some people that are neurodivergent, that's a little too intense for them, but I like that and he's comfortable with that. Um, Little small things. So telling me he loves me just because, or texting me like, oh, I'm at the store. Can I get this for you? Little small gestures that show me that he's thinking of me go a very long way.
Absolutely. And an amen from my wife on that one.
Yes, and Dr. Gottman, right? Just the love
Right,
note.
absolutely. Yeah,
Knowing what really fills your partner's tank.
Sure. And
absolutely.
what are some of the resources, just podcasts, books, or YouTube channels? What are some of the resources that you would recommend to couples that would kind of help them along?
So anything by Tony Atwood, he's a great researcher and writer and author on various things neurodiverse. A great resource is Where I Got Certified, which is the Association of Neurodiversity,
AAE.
American Association for Neurodiversity. Anything by Jodi Carlton. She's got a wonderful podcast. She has a lot of free content available to listeners. She is also a therapist turned coach whose husband had autism. One of her kids has autism. So she talks a lot about kind of just embracing neurodiversity and how to make everything work together, right, with neurotypicals and neurodiversity. And she's just a wonderful resource that has a lot of great examples that a lot of people can relate to.
I'm going to have to check those two out.
Yeah,
Those are two
she's
that I
got a
have.
great podcast, interviews a lot of different people, couples such as yourselves, where there is a neurotypical and a neurodivergent together, and how you can make your strengths work for you, how to enhance your strengths,
Yes.
work through the challenges.
And what is
Yes.
the scope of your practice and what do you offer? Is it just within the state of Florida or do you take clients outside the state? How
It
is it?
is just within the state of Florida. I am only licensed here. I work with all kinds of couples, not just neurodiversity, but also I do a lot with betrayal trauma, infidelity. I work a lot with women's issues. I'm seeing a lot of women trying to figure out like, who am I after the kids are gone? And I've met that role of being a great mom to them, but maybe they haven't worked and they're trying to figure out what their passion is, what they want to do. A lot of women that have pleasing tendencies,
I
right? That
know.
sometimes goes hand in hand with neurodiversity. We're sort of wired to accommodate and do and nurture
Yeah.
to the point where it's at our own detriment, right? So I work a lot
Yeah.
with that as well.
And you're also a Christian. Did I read on your
Yep, that is
webpage?
true. Yeah,
Yeah. So
yeah,
incorporating spirit, incorporating faith,
absolutely.
body,
Very
soul,
important for
spirit.
those that want that. Some people that's not a thing or that's a
Sure.
deterrent. For some people they want that. So if the person has a strong spiritual life, faith life, and they want to incorporate that, I'm happy to do that as well.
Mm-hmm.
Absolutely.
Mm-hmm.
Well, you are a valuable member of our Asperger's and Marriage
Yes.
Women's Group.
Thank you
Please
so
chime
much.
in. Please, if you want to share your links anytime, I'll put your links in this when we publish this. But
Wonderful.
we want to have a whole team of people that offer different resources because everybody's
Yeah.
a little bit different and
Yeah,
focused on something unique. So
absolutely.
We
My
need each other.
pleasure. Absolutely. There's strength in community and knowing you're not alone.
Yes.
absolutely.
And we have something in common, and there's nothing like talking to someone who's been there, who is there.
Absolutely.
Well,
Amen.
and I think you both offer, a little bit different that you're living it. It's not necessarily just an educational exercise.
Correct.
You
Correct.
are immersed in it.
Right.
Absolutely. Yep.
All right.
Personally and
Well,
professionally. Yeah.
absolutely. Well, thank you so much for your time. Thank you for sharing.
Thank you
And
so much. It
if you
was
could hang
truly a
on a little bit,
pleasure.
absolutely. And for those, please, we welcome any comments or encouragement that you might offer. If anybody can relate to this podcast, leave in comments, and we will talk to you in our next episode. Talk to you soon.